is Andrew Orellana. Today is the 20th of September. In this video I will be showing you 6 airway skills. The first one will be the lateral positioning of a patient, followed by triple airway manoeuvre, the insertion of a nasopharyngeal airway, an oropharyngeal airway, and the use of a laryngoscope. And lastly, I will demonstrate how to provide positive pressure ventilation using a BVM. Firstly, position yourself at the knee. Extend the far arm out and the near arm across the chest. Flex the far knee upwards. Check the pockets if there's nothing in them and remove them if there is. And slowly rotate the patient with one hand at the hip and the other at the shoulder. Rotate them on the side. Flex the upper arm upwards but away from the face, and the knee upwards towards the head. Gently rotate the head and ensure that any drainage of fluid is out. One common error that can occur is if the patient has a spinal cord injury and the head is rotated, then that should be prevented. The first step is to place a 2 to 5 centimeter pad underneath the head to maintain a straight airway. So the first step is a head tilt, which would be to place your thumb of your right hand on the forehead of the patient and gently extend it back. The next step would be a chin lift, so you put your index and your thumb on the chin and gently lift. One thing that can go wrong though is if you don't perform this task properly, the tongue will occlude the airway. A triple airway manoeuvre differs from a sniffing position in that it has a jaw thrust. A sniffing position is just the head tilt and the chin lift. And the final step in a triple airway manoeuvre would be to perform a jaw thrust. So you gently lift back like this. After this, you have to observe the airway and listen for any breathing sounds. The indications would be for an unconscious patient with trismus, whereas the contraindications would be middle third fractures or nasal trauma or a TBI with trismus. The right NPA, you have to measure the NPA from the corner of the nose to the earlobe, and the diameter of the NPA would have to be just slightly smaller than the nostrils. So this would be a good size. In reality, you have to lubricate it with KY gel. Observe the airway through the nostrils for any obstructions and insert the NPA into the largest nostril at a 90-degree angle. Put it in slowly, rotating it clockwise and anti-clockwise at 45-degree angles until the insertion goes in. If any resistance is felt, take it out immediately. One common error is that if resistance is felt and you keep inserting it, you may cause further nasal trauma or brain injury, and inspect that it has gone down properly. Ensure that the airway, the NPA, is the right size, because if it's too long it may go into the esophagus, and if it's too short it might not reach the airway. To measure the right size of the OPA, you measure it from the corner of the mouth to the angle of the mandible. OPAs would be an unconscious patient, or to be used as a bite block for ETT placement. Contraindications would be for a patient who has trismus, obviously, or a gag reflex. To insert an OPA, you grab the OPA with the natural curve upwards, insert it halfway into the mouth, and rotate it 180 degrees while inserting it until the flange is resting at the lips. Make sure that the lower lips is not in between the flange or the teeth. Check for a gag reflex and airway sounds. With the laryngoscope, you grab it into your left hand. You maintain the pressure on the forehead. If it's not tight, white and bright, it may become loose and dislodged in the airway, and this may cause further obstructions. Insert the laryngoscope into the right side of the mouth and you move it to the left side, keeping the tongue out of the way. Gently insert the laryngoscope into the airway in the vallecular groove until you can see the vocal cords or any obstruction that's in there. with the OPA in situ, I'm now going to demonstrate the final skill, how to deliver positive pressure ventilation using a bag valve mask. And select the right face mask for the patient. One of the common errors of this technique is hyperventilation. If you squeeze too hard, you may inflate the stomach. And also another error could be not maintaining a good seal, so air won't be able to get into the lungs as efficiently. So apply the rigid face mask technique and slowly deliver about 12 ventilations per minute. For the purpose of this video, I'll just be doing it over 15 seconds and only squeeze about a third of the bag in, which is about 10 ml per kilo. So we're assuming that this is an adult patient. As you press the bag, observe the movement of the chest.